Well, new treatments for breast and prostate cancer patients are being added to the Pharmaceutical Benefits Scheme. Peter Lusted joins us now from Parliament House with the details. So, Peter, talk us through this announcement.
Yeah, it's fantastic news for the 10,000 Australians who have metastatic breast cancer. That is breast cancer that has moved from the breast to other parts of the body, such as the lungs or the brain. Now, Lynparza is the drug that is already on the Pharmaceutical Benefits Scheme for people with breast cancer, prostate cancer or ovarian cancer, but it will now be extended to people who have metastatic breast cancer. The government says that this will benefit around about 300 people per year, and if it wasn't on the PBS, they'd be looking at paying $72,000 per course of treatment. Now, breast cancer is associated with a genetic mutation of the BRCA genes, and it's something that is often inherited, and that gene can become particularly risky in metastatic breast cancer treatments. Patients, I should say. Now, people who are able to actually get a test to find that gene, and what the government has announced today is that it is extending the Medicare payment so that all people who are diagnosed with breast cancer will now be able to get that test straight away. Here's the Health Minister, Mark Butler, speaking about that.
Currently, that Medicare payment has been quite restricted. We're now making it available to every single breast cancer patient. So soon after your diagnosis, you will be able to get this genetic test, determine whether or not you have an inherited genetic mutation or mutation of the BRCA genes in particular, and you won't have to pay as much as $1,200, which is what this test would cost.
Now, Talazoparib is another drug that is being added to the PBS in conjunction with another drug which will be helping people with metastatic prostate cancer. The government thinks that this will probably benefit about 180 patients per year, and if it wasn't on the PBS, they'd be looking at payments of $100,000 per course of treatment.
Peter, there's also been talk about the Albanese government making changes to bulk billing. What do we know about this?
Yeah, there's some reports in the 9 newspapers today that says the government is considering, hasn't yet got over the line, but is looking at increasing the bulk billing incentive payment for GPs and also looking at adding more urgent care clinics as well. Now, Mark Butler, as you just heard, held a press conference today. He was asked about this and said he didn't have any announcements today, but said that his government is looking at doing more for bulk billing, and he also praised urgent care clinics and the role that they are playing in taking pressures off emergency departments. Now, these reports also said that the government is looking at a possible change of moving away from GPs receiving fees for appointments to a program where they would receive an annual lump sum payment. Now, he said that this is something that he's not announcing today, but it is a policy that he has long held support for, that they would be talking to the community about this before they do go ahead, but he said it's something that they've been looking at for some time. He said that there would always be a system of some fees being paid for appointments, but they'd be looking towards more of a middle ground between that system and the lump sum payment.
Peter Lusted at Parliament House there, thank you.